Hi, welcome to NEWSTART Now. I'm Don McIntosh. We're glad that you're with us. Today we're going to be talking about the heart. And let me get it turned up here the right way. And talking with us about the heart is Dr. Brian Schwartz. He's a cardiologist currently from Ohio. We're glad that you're with us today.
Well, thank you, Don.
And you know, you talk all day about the heart to people, and you know, you're an interventional cardiologist,
That's
right?
right.
So that means you can do interventions. I want to talk about, you know, people come in and they have these feelings like their heart's jumping or different things. And what's happening with that? Can you talk to us about these kind of things?
Sure. We call those palpitations, the feeling like your heart is skipping beats or racing. That can occur from several different things. Probably the most serious cause is a condition called atrial fibrillation.
Okay. And where are the atria?
Yeah, atrial fibrillation occurs when the upper chambers of the heart, and there's four main chambers, two ventricles, two atrium.
Okay, so if I was looking at this and I opened it up here, that would be, let me just see, where are they?
Oh, there they are.
All right,
So
hold it right to the camera there.
Atrium, the left atrium, the right atrium are on the upper parts. The lower chambers are called ventricles.
Okay, so the atrial fibrillation, is this part kind of shaking?
So atrial fibrillation absolutely occurs when the upper chamber may stretch out or dilate a little bit, and then instead of the natural pacemaker, which is located up in the right atrium, taking over and controlling the rhythm of the heart on a regular basis, the whole upper chambers just kind of fibrillate in a disorganized manner, and that's why we call it fibrillation.
Now, why is that so dangerous? You said it's one of the most dangerous things. Why is that dangerous?
Yeah, it's first of all, it's a very common condition. 1 out of every 5 people over the age of 65 may develop it. And the biggest risk is that it can be an unrecognized source of a stroke. When the upper chamber is just fibrillating and not squeezing vigorously, blood can just pool and swirl around in there, and eventually it could lead to a small blood clot forming. If that blood clot then broke loose and traveled up to the brain, it could cause a stroke. And so this is a common cause of a stroke.
So what do you do for that? Can you help people with that?
Yeah, so the first thing is to recognize that problem does exist. Sometimes we can just use medicines to control the rhythm of the heart and prevent the atrial fibrillation. There are some special procedures where catheters can be placed up into the heart that can create a scar that reduces the risk for atrial fibrillation. But in a large group of patients, we have to use medications to prevent a blood clot, and so they would have to go on a blood thinner medication.
And there's really not any kind of natural remedy for that. They really need to see someone like you.
Yeah, if someone truly has atrial fibrillation, I'm not aware of any supplements that would have in effect to thin the blood enough to prevent that risk for stroke.
So you said you can put like a little tube up there and cause some scarring, and I imagine that just kind of makes it so it can't fibrillate as much. Is that the idea?
It actually, part of the reason why fibrillation occurs is because if the atrium is too big, it takes a long time for the rhythm to travel all the way around the heart.
I see.
If we can reduce the size, either by doing surgery and cutting out part of the atrium, or by creating a scar that isolates the upper part of the atrium from the main body of the atrium, that has less tissue, and it can actually cause normal rhythm to be restored.
Fascinating. So there's atrial fibrillation. What other kind of rhythms do you see?
Okay, so commonly in young people, we'll see just occasional skip beats. And it's not uncommon for a young person to feel just a skipped irritable beat that comes from the upper chamber of the heart. We call that a premature atrial contraction, or PAC. They may occur frequently, and particularly during periods of stress, like when someone in college is taking exams. It can change with changes in hormones. If someone becomes pregnant, it becomes very common. Excess caffeine makes the heart much more irritable and is much more likely to cause PACs, or extra beats. And then you can also have a beat that comes from the lower chamber called a PVC, or a premature ventricular contraction.
That's a little more dangerous?
Not if they occur. Almost all of us, you and I, probably have a few of these every day, and we just don't notice
Especially when we're in front of cameras or something.
That's right. But when it becomes more frequent, or if it were to become continuous, a whole run of PVCs we call ventricular tachycardia, that can be life-threatening in a weak heart.
So really, to figure this out, though, you need to see someone like yourself, someone that can tell you which is happening, get an EKG, look at that a little bit more closely.
The most important thing is to identify what type of rhythm it really is. We do that either with an EKG or by wearing a heart monitor for 24 hours and an echocardiogram to tell us if the heart is stretched out or dilated.
We've been talking with Dr. Brian Schwartz. We've been talking about these different arrhythmias, or heart palpitations, and different things that you may need to check out. When you come to NEWSTART here, we do those kind of EKGs as well. Not everything he's talked about, but some of it. And we hope that today you've learned something that can help you with your heart and help you have a new start right now. If you want some more information, go to our website and we have some more there. Thank you for being with us, Doctor.
You're very welcome.
And thank you.